at Queen Nandi Regional Hospital in Empangeni, where the Department of Home Affairs is launching the campaign in relation to the parents to try and make sure that they register their children at birth. Next to me is the Deputy Minister Njabulo Nzuza, who will briefly tell us about this campaign in this hospital. Thank you very much, sir, for your time. Briefly about this campaign.
Yes, this is a campaign for early birth registration, where we are saying mothers must register the birth of their children within a period of 30 days. This is what allows the child to exist in South Africa, because if the child is not registered, they do not have an ID number, which means they do not have identity. They literally become a ghost. So we have opened Home Affairs offices in hospitals. Today we're here in Queen Nandi to witness it live on Christmas Day. We have had 8 babies that have been born. We have issued 8 birth certificates to those mothers and for their children, which is very significant for us, because it means the system does work. The offices that we set up in health facilities where beds are given, they really assist, because mothers are able to leave the hospital in possession of the birth certificate of their child.
This is not a new campaign, Deputy Minister, because previously we did see that the MECs, also the ministers, were also encouraging the residents to register their child at birth. Is it because the message is not going through?
The message is going through. The only issue is that we must do more media campaigns and partner with yourselves as a media boutiques, so that more knowledge, because if it's not repeated, it fades away in people's mind. And some of the problems is that people come without carrying their identity documents, some come without having prepared, some still say, no, we are waiting for fathers, and so on and so on. So that is why we will consistently drum up this message, so that it does not fade away. This is a very important thing. In future, we don't want to meet a 15-year-old, a 20-year-old, even a 30-year-old that will say, I don't have identity because I was never registered at birth.
We do have that challenge in South Africa, where you receive the older ages going to Home Affairs to register. What is the challenge? What is the criteria to assist them? Because we do understand that we do have those kind of people.
Well, there is a process for late birth registration, where we register people even when they are old. But that process requires us to do certain investigation, because we are a receiving country in terms of foreign nationals who come into our country. And therefore, we have to put in internal control procedures of people who come into the country. And that is why we have to do interviews. We have to go and check now which school you went to. We have to go and check with traditional leadership. So there's a lot of balance and checks. But when you capture the birth as it occurs in the hospital, where the mother is still with the child and the mother has all necessary documentation, it is easier to certify that that person is a South African, and you can issue them with a birth certificate. Because you must remember, in South Africa, you do not become a South African just because you are born in South Africa. You become a South African if one of your parents is a South African. So when the birth occurs, you have 2 important people there. You have a mother who is a South African, you have a child who is now a South African, and it becomes very easy to issue the identity on spot.
What is the message to the parents outside?
Please register the birth of your child within 30 days. Make sure that you do not leave the hospital without registering the birth of your child. We are really requesting. Fathers, they have a tendency of disappearing on birth, and also in terms of when it's come to register a child. Fathers must be there, they must appear on the birth certificate, so that whatever happens to the mother, you still have a record of a father that is there in the birth certificate and is part of the child's life.